Hello, my name is Dr. Prashant Deshpande. Welcome to Dr. D's Table Talk. The purpose of this video channel is to provide basic understanding of the common medical conditions and facts based on science. In this video channel, I plan to interview experts in the medical fields and want to cover topics ranging from vaccination to healthy diets and everything else in between. Welcome to Dr. D's Table Talk. We have with us today Dr. Dennis LaMonte, who has an office in Frankfort, Illinois, and who is a diplomat of American Board of Pediatric Dentistry. His office is Treasured Smiles in Frankfurt. Welcome to the program, Dr. LaMonte.
Good morning. Thank you very much, Dr. Deshpande.
You're welcome. Let's jump right into the program. So, when do teething begin in an infant?
Well, typically teething begins right around 6 months of age, and it usually runs all the way through around, I'd say, about 2.5. So most kids follow that direction, if you will, but it's not set in stone. I always talk to our parents and our children and say, listen, every kid doesn't follow the rule book. So some parents will get anxious around 8 months or 9 months, or even a year for that matter, when they have a child who doesn't have a tooth yet. But it doesn't get us too excited. It's normal. So just because the average is 6 months to get your first tooth doesn't mean it's going to be, the same for your child or even siblings for that matter. Some kids may be 3 months or 4 months when they get their first tooth. Some might be sometimes 14, 15 months before they get their first tooth. So we have a tendency to compare our children to other, friends or family members as well as siblings, which will get parents anxious certain times. But just know that not every kid follows that rule pattern, and it's okay if they're different. Not everybody's going to be the same. And one other caveat to that is, in the almost 20 years I've been practicing, I've never seen the baby teeth not grow in. So they may be late. Just be patient. They'll be there sooner than later. So
That is very reassuring. That is very reassuring, isn't it, to the parents?
Yeah, it is, because they get kind of anxious about it.
So what do teeth do? What's the function of teeth? How do you explain to a child as to he or she should take care of their teeth and brush it?
Well, there's the obvious answer, right? What do teeth do? When we talk to a child and we say, hey, kiddo, what is the purpose? Why do we take care of our teeth? Why is it so important to keep these teeth clean and healthy? The number one they always tell you is the obvious one. Well, you need them to chew, right? Which, of course, we need our teeth to chew our food, to be able to, chomp up all those hamburgers and hot dogs and so on. But the other thing we always tell kids is, listen, we got to take care of those teeth. We need our teeth. Why? So we can smile. So we can give a big giant smile to grandma and grandpa and mom. And on our picture day at school, kids relate those teeth to really two things: to their ability to eat, number one, and that giant smile, number two. So those I'd say are the main purposes of our teeth.
I think the second reason is very exciting to me. So that's why.
It's probably more so than the first. You got it.
So that leads to my question. How do we take care of teeth in a 6-month-old? And when should a child be seeing you for your dentistry? Typically around age 2 to 3 years of age. So if you could comment on care of teeth in first couple of years of life, and then maybe subsequently, what age should they see a dentist?
Great question. I'm going to start with the age first. Really, the biggest push that pediatric dentistry has had, I'd say, at least over the last decade, has been what we call the age 1 dental visit. Is getting children into the dental office by the age of 1, or another caveat to that is no greater than 6 months after the eruption of their first tooth, but definitely by the age 1. And parents will ask, well, why? Well, there's really 3 important reasons why we want to establish a dental appointment by age 1. Number 1 is to and probably the most important one, is so we as pediatric dentists can focus on prevention. We have a lot of children who show up at our office, for instance, sometimes 4 or 5 years old for that kindergarten school form, and we'll see them, we'll take x-rays, and we'll find a boatload of problems. A lot of problems that we'll say, man, I wish I knew you earlier. I wish I met you when you were 1, so we could have talked that young mother or father about, how to prevent these problems from happening. So the biggest, most important thing, number 1, is prevention-based. Number 2 is what we use a fancy term, anticipatory guidance. an ability to teach those parents, especially new parents, what to expect with teething, how to brush the teeth, what kind of effect does diet have on that child, things of that nature. So to be able to let them anticipate what's going to happen, when are teeth going to grow in, how are things going to change, and so on and so forth. And the third thing, and also very important, is to establish a dental home in the event that trauma occurs. Let's say this young child at 1.5 years old falls and hits a front tooth, and there's trauma, and mom's nervous and scared. Who does she call? Does she go to emergency room? Does she go to call Dr. Deshpande and her pediatrician? So having that pediatric dentist, that place you call home in the event of an unforeseen circumstance like that. So back to your question, when do we start? Our biggest push is the age 1 dental visit for those big 3 reasons. The other question is how do you take care of them? A lot of that is age-based and cooperation-based. Let's start with the youngest, simplest one. Let's start with that. Let's go back to the 1-year-old, let's say. That 1-year-old who might have 8 front teeth and maybe a molar in the back growing in. So not a lot going on. A lot of these infants, even prior to that, 7, 8 months old, and speaking to a dad of 4 here, so I've got 4 children that I have a lot of experience with, is starting with a simple little washcloth. When that child's an infant and that little baby's, in your arms, let's say the little one has a bottle of milk before bed, they've got a couple of front teeth, you're not going to stick a toothbrush in there and aggravate that little one. Take a washcloth, put it over your finger, dip it in a little bit of water. At that point, we'll talk a little bit about toothpaste in a moment, but there's particular type of toothpaste you can place on that washcloth and simply just wipe those teeth down. Even taking your finger to wipe off the gums, wipe off the tongue, get some of that residual food or milk out of that mouth. So in the simplest terms with infants, a simple washcloth is the way to go. I start adding toothbrushes to the formula here as those children get their back teeth, or what we call molars, grow in. So we come late 1s, early 2s. We now have molars in the back. They're the groovy teeth with the pits and fissures where the food likes to get stuck. That's where an infant toothbrush comes best. Some folks like the little infant toothbrushes they can put on their finger. Some people love them, some people hate them. That's kind of just a personal preference. And others just most toothbrushes come age-based, and the age-based purpose of that is the size of the head, so it's small enough to fit in a little kid's mouth. And number 2, the size of the handle, so it's easier for that child to hold on to as they practice and learn to do it themselves. So following the little age-based bracket on the toothbrush is the easiest way to go.
So that leads to my second question, which I'm sure you've heard. Some kids love brushing teeth and they will brush for minutes and longer time, and some hate it. And then what happens if my child were to swallow a toothpaste which probably has fluoride or no fluoride in it? Is that something harmful to the child, or a small amount of toothpaste probably won't matter much as regards to the toothpaste?
Great question. This is something we're asked, and I probably talk about 30 times a day. Toothpaste, in my opinion, as a pediatric dentist, I think toothpaste is a wonderful tool to help with prevention. The purpose of that toothpaste at a young age is the addition of what we know of as fluoride. And we know fluoride is the ability to strengthen our teeth and therefore help prevent tooth decay. But what about in these young kids, and how much do we use? So in my practice, what I teach the parents is under the age of 2, I don't use fluoride toothpaste at all. The purpose being because they swallow pretty much anything you put in their mouth, they're swallowing. And at that young age of 2, under 2, I should say, down in the bones, you don't see it, but down in the bones at that young age, permanent teeth are developing. And an overabundance of fluoride in their system during the development of those permanent teeth can cause what we call fluorosis, or permanent color changes to the permanent teeth, which nobody, of course, wants. After the age of 2, between about 2 to 3.5, and that 3.5 number is flexible, but that's usually when most kids learn to spit their toothpaste out. So let's just say between 2 and 3.5, when that child is still swallowing, but now those teeth are a little further in development, we start adding toothpaste. But at that point, it's then based on risk factors. Those risk factors may be, do you have a sibling? Let's say I have a 2-year-old child whose 4-year-old brother's had 6 cavities already. That would raise that child's risk factor. Another question we ask is, what city do you live in? And the purpose of that is, here in my office, I work in Frankfurt. Frankfurt gets the public well. The public well water here in Frankfurt is not fluoridated compared to the folks in Mokina who get Chicago City water or New Lenox and so on, where they do get fluoride in their water. And there's a lot of studies out there that show that fluoride in the water systemically has the ability to reduce cavities in infants dramatically. So that's another risk factor we weigh, whether or not you're getting fluoride source via your water. Right. And then the last one that we look at, and the most obvious one, of course, is our own dental hygiene in our own mouths. So if we have a young child at 2 years old that has a really clean mouth, the parents are taking really good care of the infant, the child doesn't have any dietary issues, so everything looks good. Let's say they live in Mokina and they're getting Chicago City water, and their siblings have never had a problem. In the best case scenario, between the age of 2 and 3.5, I have those kids use fluoride toothpaste no more than 2 times a week. I always try to keep it easy and say, hey, Monday night and Friday night, let's make that the fluoride party. The rest of the week, use the non-fluoride. And then that changes based on risk factors. Those whose risk factors are increased may use it 3, 4, 5, or 6 times a week. It all depends on each individual. So, we kind of evaluate a kid individually to see where they stand.
Perfect. When we go to a dentist, we often talk about teeth and teeth and teeth. And when I've been visiting my dentist for the last so many years, they often talk about gums. So how important are gums, and what is flossing? If you can elaborate that, and what age a child should be flossing appropriately?
Those are great questions. I'm going to answer every one separately. Gums. Our gums, yes, at the dentist, everybody thinks teeth. Remember, what holds your teeth in? The gums and the surrounding structures, right? So if we don't have healthy gums and healthy surrounding structures, our teeth don't last, right? That's where we get into periodontal disease. Periodontal disease and gum disease tends to become more prevalent in our teen and adults, not so much in our children. But those building blocks of good hygiene lead to good gum tissues later. So one thing we talk about with parents, especially as these kids get a little older, and I won't even get into it, but braces, when they have braces on, and how to properly clean around them. But again, back to infancy, one important thing we talk about, and I'll use my hand to show this. If my hand is a tooth and my watch in here is the gums, we don't just brush here. We brush here. We get not only our tooth, but we get our gum tissues as well. Because maintaining oral health is, like you said, Dr. Deshpande, is not just brushing teeth. It's brushing gums, and it's also brushing our tongue. It's having that young kid stick his tongue out and brushing as well as you can without, going too far back and causing any problems. But yes, gums are extremely important for general health. Now, how does that lead into flossing you mentioned? Flossing is really important. Here's the reason why. The number one cavity we take care of in children is a cavity that's not on the chewing surface of your teeth, but rather between your teeth. So you can imagine when 2 teeth in the back touch each other, this child can be the best toothbrusher in the world, but the toothbrush never gets right here. What's the only way to clean between our teeth? Or I'd say the most efficient way to clean between our teeth is with dental floss. So when does a child need to floss? When the gaps between the back teeth close, that's the signal that it's now time to floss. Okay. You don't need to floss here, but you do need to floss here, if that makes sense.
Great.
Yeah.
Great. This is a question which I've been dying to ask you. Why do dentists hate sugar in candies? I love my candies.
I love candy too, right? Here's what I talk about with parents is sometimes I catch them off guard, because when we talk about dental health, we always bring up diet. And I always start by telling parents, I really don't care what you eat and drink. Most kids don't live on a diet of Snicker bars and jelly beans. Now, granted, they may want to, and they may get their fair share. But most of them have their standard diet of peanut butter and jelly and goldfish and crackers. And most parents try their best with their fruits and veggies. Here's what my focus is on in my practice. When I talk about diet, I talk about the effect of our mouth on sugar. You got to remember, sugar comes in a lot more than candy canes and jelly beans.
Right.
Sugar comes in goldfish, in crackers, apples, bananas, and pears. It comes in milk. It comes in bread in our peanut butter sandwich.
And juices.
And juices. Yes, exactly. So what I focused on is less on what we're eating and drinking and more on how often we're eating and drinking. So if we know that a majority of what these children are eating contains some level of sugar of any sorts, we think about the patterns of diet versus what we're eating. And I'll give you an example of that. I talk with my hands if you haven't noticed.
No, so I'm going
to use my hands again. So let's start with breakfast. And a child has a bowl of Cheerios and a glass of orange juice with their breakfast. Both the Cheerios, which are carb-ridden meal, as well as that orange juice, both are sugars that elevate the acid in our mouth. It elevates it now to a level where cavities can now grow. That's normal. It happens when we eat. But we have enzymes in our mouth, and our saliva, our spit is good. It has enzymes that break down that acid and neutralize it. Fine. That's normal. Now at 10 o'clock, we have a snack, and our enzymes neutralize it, and it comes down, and so on and so forth. 12 o'clock, we have lunch, and so on. That's a normal pattern. Now compare that to this. A young child who has breakfast at 8, goldfish at 8:15,
right,
sippy cup of milk at 9, Cheerios at Target at 10, sucker at the bank at 10:15, all day long, that acid stays high. So these children who tend to snack more and nibble more, even on our goldfish crackers and Cheerios, still tend to keep that acid level high and have a high risk for cavities as a result. So our focus tends to be less on, listen, parents are smart. Let's stay away from our jelly beans and our candies, except for special treats. We get it. But remember, it's that consistent snacking between meals that keeps the acid high and the risk for cavities great. To me, that's probably the most important thing.
So too much of acid in the mouth is bad. So for example, juices that obviously some of them could be acidic and can erode the teeth, just like a stone being scraped by constant rains. The acid kind of washes the protective covering around the teeth area.
It's perfectly put. Yes. Yes.
Thank you. Good, great. What about bottles and sucking on thumb or sucking on fingers? How do they affect teeth and gums? And what do you suggest to the parents for thumb sucking and prolonged bottle use, say after 18 months of age or so? Does it not lead to the same kind of consequences that you just talked about?
Well, two different things. Let's talk about the bottle first. What does a bottle do? Most kids who suck on a bottle or drink from a bottle or drink from a sippy cup, it goes back to what I just discussed, the long-term presence of that acid. A child who has a cup of juice may drink that juice and it's gone within a minute or two. A child who might have a bottle or a sippy cup of that juice has that juice around for not a minute or two, but sometimes 10, 15, 20 minutes, or sometimes overnight in their mouth. So again, it's the presence of that insult. How long is that juice or milk around, and how long does that acid level stay high? So that's, again, back to what we just discussed. In terms of the effect on our mouth from thumbs and pacifiers in that way, that's less to do with cavities and more to do with orthodontics and tooth placement. So let's just talk about pacifiers and thumbs, for instance. Pacifiers are a little easier because, well, you can get rid of them, right? Thumbs, you can't really get rid of. So I'm a father of 4. I had 2 thumb suckers in my house. I'll tell you exactly how I manage them. I'll first start by telling you what can thumbs and pacifiers do. I'll use my hands again. Here's your front teeth. Here's the pacifier of the thumb. The thumb can push the teeth up and flare them out. So in a normal bite that might be here, those teeth become open and flared. As the habits go away, that flaring naturally fixes itself and comes down to normal. It typically takes anywhere from, I'd say, 10 to 15 months, up to about a year and a half even, to where that you'll see that almost correct itself completely, assuming we get off that habit by the age of 3. So our goal as pediatric dentists is get these children off of what we call non-nutritive habits like thumbs and pacifiers by the age of 3, so these things can correct themselves. How do you do it? Most parents with pacifiers do one of 2 things. Most, I'd say 80 to 90%, pick a weekend and go cold turkey. They take them, they give them to the binky fairy. The binky fairy might leave that child a little prize at night, and then they have a couple rough nights. So you have a rough Friday night, a rough Saturday night, and then come Sunday, life is good and the pacifiers are gone.
Sure.
Others will break up the pacifiers and make them less soothing. They don't get as much success from that. Parents tend to do more of the kind of cold turkey approach.
I heard of tooth fairy, never heard of a binky fairy. So do you get the same amount of money under your pillow if you get rid of the binky?
The tooth fairy's the banker. She leaves the money behind. The binky fairies tend to leave presents. The binky fairies like to trade. So they'll often, what I always tell my children is when you leave that binky for the binky fairy, ask her for a nice doll, something you can squeeze at night to help replace that sensation seeking of the mouth, some other sensory tool to kind of help them relieve them of that. Yeah, so so that's what our binky fairies typically leave behind, something fun to hold on to.
I think that's a great concept. Thank you.
Yeah.
That leads me to the next question. Grinding of teeth, is that a habit, and what do you do to protect the teeth and the gums and the palate when children grind teeth? And I know there could be various reasons for grinding of teeth, and we don't know the exact reason why grinding of teeth happens. So how do you take care of grinding teeth, especially when they're making that pretty bad noise at night when they're fast asleep? So
Sure. Well, my running joke here in the office for parents who have children who grind, I always say, hey, the best investment for a child that grinds is a good pair of earplugs for mom and dad, just to cover the ears, because there's not a whole lot we do for children grinding. There are some steps that can be taken as we become, maybe around 10 years old or so, that 9-10 range, if the grinding continues. But to be honest with you, most of these young children that grind, and I had one of my own, most of these young children that grind their teeth, it's very common. Tons of children do it. We kind of coin it as part of growth and development, changes in the mouth, changes in the jaw, changes in the occlusion. Most children do grind their teeth to particular levels, some more than others. And I'd say that the studies show, and then just clinically it shows, that I'd say upwards of 90 to even 90 plus, 95% of these kids, when they become that range of 6-7 years old, and they get their big molars in the back that grow in, and those big molars interdigitate with each other, and their big front teeth grow in, a majority, if not close to all, stop the grinding at that point. So we don't do a lot about the infant grinding, quite frankly, because you're not going to get a 4-year-old to wear a mouth guard, at night especially. And number 2, it really has no long-term effect. Most of these kids will stop when the permanent teeth begin to develop, and it just becomes a moot point at that point. So hence the earplugs.
Yes, I had heard of charity begins at home. I had not heard of pediatric dentistry begins at home for a pediatric dentist. So must have been a very humbling experience for you.
It was. And it's, I use that as an example with my parents all the time. I remind them, listen, I'm not just a pediatric dental specialist. I'm a dad. I'm a dad of 4. And I've dealt with 4 infants, all who were completely different from each other in terms of, I had 1 or 2 who were wonderful brushers. I had a couple who weren't so easy. So it's hard for me at home too, just like it is hard for these parents. So it's something that's been the best part of my practice, is that I can relate to it. I live it, which makes it wonderful. Yeah.
Yeah. Great talking to you with the last 20 minutes or so. Any concluding thoughts or comments for our parents and how, for kids?
Yeah. I always tell parents that, listen, it's hard. Taking care of your kids' teeth is hard, right? Some kids are cranky. They don't want you to do it or put up a fuss. But just understand the importance of it. Maintaining oral health at a young age is what makes those building blocks for maintaining oral health and having good quality oral health as we get older. So fight through it. Make sure as a parent, you're still helping that child out. a lot of folks come in with these sometimes 2 and 3 year olds and say, hey, Johnny does it himself. And I say, yeah, you know what? I'd still be involved one way or another. If not directly, at least indirectly. Be in that bathroom. Listen, we got to brush our teeth twice a day too. So how about you brush together? Make a family event out of it. So, don't give up even when it's tough. And, you'll reap the benefits. I should say your child will reap the benefits as they get older and really understand the importance of good oral health. So thank you very much.
LaMonte. Thank you.
You're very welcome.
Great advice. Thank you for your time.
You're very welcome. Anytime. Thanks, Dr. Deshpande.
You're welcome.